Candidates Forum. I welcome candidates. I'm Jon Reisman. I will briefly introduce my co-moderator and our stellar IT team here that's helping us put this together. Quickly go over the ground rules and then allow the candidates to start giving 90-second introductory remarks, and then we'll get to our questions. This forum is being streamed onto the UMM's YouTube channel, and the public will have a chance to type in their questions, which will be relayed to Tora. She'll be answering them, asking them. So first, let me introduce my co-moderator, Tora Johnson. Tora is a professor of Geographic Information Systems at UMM, also the chair of the Science Division, which is a thankless task. And also a member of the governor's climate. Sorry, everyone.
That's right. I'm part of the resilience working group on the governor's climate council.
Okay. Helping us put this together and hopefully making sure we don't have any problems is Jonathan Stentz, crack IT guy for UMM, real asset to Washington County. And I want to thank John for helping me make sure this goes off okay. We've invited the candidates from Senate District 6 and the 4 House districts that are in Eastern and Central Washington County. And the way this is going to work is each candidate will get a 90-second opening and a 90-second close. All candidates will get an opportunity to address each question with 1-minute answers if they wish to address it. Tora and I will allow some back and forth as appropriate. I don't anticipate there's going to be any attacks or things like that, but if there are, we certainly will allow some back and forth. We'll start with Senate District 6, followed by House District 138, 139, 140, and 141, and end in the reverse order. The first question, which will come from me, we'll start with SD6. We'll start with the introductions with Senate District 6, and in each case, in each district, we'll start with the incumbent and then go to the challenger. Let me ask Senator Marianne Moore to unmute herself and give us a 90-second introduction to be followed by Jeff Lovett. Okay, Marianne.
All right. Good evening. Thank you, John. I really appreciate it. I must say, I really would have preferred to have been in person. I missed that whole of all of us getting together and sitting around the table. I think that would have been a fun thing, but understanding the situation with COVID-19, if this is the best that we can do, this is great. My name is Marianne Moore. As John mentioned, I currently reside in Calais. For the past 2 years, I have proudly represented the citizens of Maine State Senate District 6, which includes all of Washington County and the communities of Goldsboro, Sullivan, and Winter Harbor in Hancock County as well. When I was elected in 2018, I strongly felt it was my job to be there in Augusta to represent my district, which is why I made it a point to have a 100% attendance record. I am running for re-election because I want to continue to be my constituents' voice in Augusta. I will continue to draw on my experiences as a small business owner for more than 12 years, a corporate management specialist for more than 30 years, a hospital trustee for more than 8 years, a former city councilor for 9 years, and a mayor for 2 terms to protect the best interests of my constituents. Thank you again for the opportunity to be here tonight.
Thank you, Marianne. Jeff?
My name's Jeffrey Lovett, and I live in Addison. And when talking to voters, the question that I am asked most is, why did you decide to run for the Senate? Running for the state Senate was not on my bucket list, and I retired after practicing law for 41 years. Since retiring, I have been a volunteer for SCORE, offering business mentoring to small businesses throughout Washington and Hancock counties. Although happy in retirement, when offered the opportunity to run for the Senate, I jumped in. When my wife and I came here in 1974, We did not know anyone in the area, but the community welcomed us, and here we were able to build a law practice, build a house, and raise 2 boys. In the Washington County of today, it is far harder to start a business than it was in 1974. In 1974, all business was conducted either in person or by phone. Now broadband and cell phone services are essential parts of any business. Without reliable and affordable internet, it is like trying to light a fire in a wood stove without kindling. Washington County needs a senator who understands the needs of businesses today and will fight consistently for those services they require.
Thanks, Jeff. Oh, go ahead.
I got one more sentence.
Go, please finish. I hate cutting people off, but
okay.
Go ahead.
Without new businesses, our local economy will continue to shrink, and without jobs, we will continue to see our children and grandchildren move away to find work. This has to change. Thank you.
Thank you, Jeff. We did invite all the candidates for House District 138. The incumbent is Robert Alley, who I spoke to, but maybe joining us later. I'm hoping, but he's not here. His challenger is Kimberly Robinson. Kim, go right ahead. Just remember to unmute.
Yes. Hello. Some of you will remember me from 2018. I'm back. At 2018, when the election came out around, when you guys were getting the tallies of who voted for who, I got diagnosed with cancer, breast cancer. And currently I am cancer free. I've been through my treatments, and when it came time for the election, my name was originally on the ballot, and we were looking for somebody who would stand up and jump in and represent all of us. And well, nobody stood up and did it. So when it came time to either take my name off of the ballot or to stay and represent the people, I decided that I couldn't just take my name off. I truly want to be here. I want to represent the people in my community, and I want to do them justice. And I want to fight for what they want to see in this community. So I'm here to represent the people. And basically, if what I stand for is I want to look out for the small businesses and the large businesses in my community. I want to make sure that they have every opportunity to recover from this COVID and this entire disaster from this year. And I want to look out for our school children. Our children are in the school system, and from what I hear about the education they're getting, it really upsets me. And it upsets the people in my community. So there needs to be some changes made there. You know, I want to look out for the lobster fishermen and the clam diggers. You know, they all have a very hard way of life there, and they need support.
Thank you, Kim.
Okay.
So in House District 139, the incumbent is Will Toole. We also invited Pat Godin. She may be joining us, maybe a little late, I'm not sure. But Will, I see you're unmuted, so go ahead.
Well, good evening, everyone. It's an honor to be joining you all tonight, albeit by non-traditional means. I want to thank you all. I want to thank the university for hosting this gathering tonight. I'm Will Toole. I have represented House District 139, which is Cutler, East Machias, Eastport, Lubec, Machias, Machiasport, Rope Bluff, Whiting, and Truscott for the past 6 years. During that time, I have worked with all of our delegation, Republicans and Democrats alike, on a bunch of different things, not the least of which is fighting to keep and eventually reopen the Down East prison, which should be reopening next summer. We have worked on a wide range of issues, funding the Veterans Home, keeping that so that doesn't get shuttered. We have worked on any number of issues. We've come together on broadband when needed the most. The legislature this past year did a bill on that to get funding for broadband, and not just a bond issue, but some more secure funding beyond that. More does need to be done, I believe, but it's an honor to be in the legislature, and it's one of the biggest things I've tried to do since I've been there is work with folks on both sides of the aisle. I've served as co-chair of the Caucus on Aging with folks from the other party as well, and I find it's an honor to be in the legislature, and I look forward to continuing that work. As we navigate the pandemic, we really need to have experienced leadership across the board, and I think I'm looking forward to doing that in the months ahead. Thank you,
Will. Thank you, Will. House District 140, incumbent is Ann Perry, and challenger is Michael Lawson. Ann, please go unmute yourself and go ahead.
Thank you, John. I will start that I've been here for 21 years, and 20 of those years I worked as a family nurse practitioner in the area. And through that period of time, looking at the substance abuse issue that we had, was part of an organization. Actually, we developed an organization called Neighbors Against Drug Abuse, which was a grassroots organization to bring treatment to Washington County because there was none at the time. We were able to do that with a grassroots effort. And this is my second set of term limits. I was elected and did 8 years in the early 2000s. And the first bill I introduced is the prescription monitoring program that we use now. Also, with the work of the delegation, we were also able to pass a bill to set up the ability for people to get to treatment with a phone system for Washington County as a pilot project, with the opportunity that if this works, this will work for other rural counties. I have had the pleasure of working with our delegation, actually, because I'm running for my 7th term, all the way through that time. Washington County, and I say this proudly, we, whoever we are, work together. We have dinners every Wednesday together, and anybody who comes from our area sits down with us, and we get to learn what's going on together. We represent all of the people of our districts, regardless of affiliation. And I am proud to be a part of that. Thank you.
Thank you, Ann. Michael, please unmute yourself and give us a 90-second introduction.
Good evening. My name is Michael Lawson, and I am the candidate for House District 140. I'm a resident of Charlotte, married with 3 adult children and 1 grandson. And our middle son works down in the county sheriff's department in Machias. I am a disabled Marine Corps veteran with 7 years, and I am a small business owner, and I also manage a business up in Calais for a local family. I'm a strong Second Amendment supporter. I support personalized health care. I believe in local control on the education system. I believe that the local people know how to do it best for the kids and the people in their district. I believe in the Constitution and our Bill of Rights, and I believe in a limited overseas intervention. I'm also a conservative who supports private sector jobs, small businesses, and education. Again, as a business owner, we need private sector jobs out here so that we can get our revenues increasing for the state with the big budget deficit that we're coming into. I believe in state sovereignty as well, and I believe in the ability of all the people to govern themselves with a smaller government. Some of my past, I was a Civil Air Patrol pilot out in Colorado. We flew search and rescue missions. I was a mountain mission pilot there. I was a squadron commander for 8 years, and I sent a lot of the kids to the military academies to be serve as officers in our military. I was a volunteer firefighter with the Hanover Fire Department in Hanover. and I was on the school board out there. So I look forward to supporting you and supporting every person in this district the best that I can if I'm elected. Thank you.
Thank you, Mike. House District 141, which is a big district, is represented by Kathy Javner. Challenger is Mr. Greene, Don Greene. Hi, Don. I see. And so, Kathy, I see you're unmuted. Go ahead, and then Don will follow.
Great. Thank you, John. I appreciate it greatly. Just thanks for setting this all up again tonight. Last year, it was one of the highlights of, 2 years ago, it was one of the highlights of my campaign. And it has been an absolute privilege and an honor to be the representative of District 141, which is extremely large. If I didn't think that my love for Maine could grow any stronger, it certainly has these last 2 years, as I have been humbled to be the representative for the residents of District 141, to go to Augusta and to testify in committee before them, to serve on committees. I serve on the HHS committee and the Marine Resource Committee. And so the learning curve has been very steep, but I haven't backed down from that. I'm not afraid of challenges, and so I have appreciated it greatly. One thing I've really striven to do in my 2 years as a representative is to make myself available. I try my best to answer every email, every phone call, and do my best to find the answers to those questions that everybody has asked me. It has been quite the adventure, and I'm looking forward to it again. And I'm looking forward to tonight and answering these questions. And I echo Representative Perry and saying that the Washington County representatives are the absolute best. And it has been truly an honor to serve with each and every one of them. Thank you, John.
Thank you, Kathy. Don, I should just disclose that Don is a close neighbor of mine, as close as we can be in these areas. So I drive by his house well, not every day anymore, but most days when I go to work. So Don, go right ahead.
Yeah, thank you, John. And thank you all for being here. And my name is Don Greene, and I'm running against Kathy for representation of District 141, which is quite large, as everyone has said. Actually, it's 50 plus towns, townships, unincorporated plantations, and so forth. And it includes 2 counties in two townships in Penobscot County. Having driven all over the place and spoken with so many people, it really is large. For background, I'm currently retired. I have a master's degree in Christian studies, and I am currently employed as the bereavement coordinator for Down East Hospice Volunteers. I've been in construction for over 40 years. I've built from scratch over 300 homes for families. I've been a volunteer firefighter like Mike in Fairfield, and I've been an EMT. And in fact, I was trained as a state instructor for emergency medical services. I am a conservative Democrat, which is something odd to hear about in today's society, all this liberalism and so forth. But I believe in the Constitution. I believe that we are all created equal. And I believe that in Washington County, we do have racial problems that need to be addressed. They are with our neighbors who live in our own communities. And although Native Americans are quiet people, they are people who need our respect and should be respected for all that they have done with us in Washington County. Being a rural county and a rural community, we do work together, one with another, and we rely on one and another. I see John nodding. My time must be up.
I'm not a good person. It's particularly hard in the, we used to flash a little yellow card up for people, but it's a little harder to do here. Thanks, Don. You'll all get a chance to.
Nodding works, John.
Okay, I'll keep doing that. Before I get to the first question, I just want to, for anybody who's watching on the chat, you do have an opportunity on the UMM YouTube channel. You do have an opportunity on the chat to type in a question or a comment, and we will get to all those that we possibly can. And I see there's one in there, and Tora will be doing those, and please join us with those. My question to start us off, last session, the legislature passed and then narrowly defeated the National Popular Vote Initiative, backed by the League of Women Voters and other national groups. The NPV would assign Maine's presidential electoral college votes to whichever candidate won the national popular vote, regardless of how Maine voters voted. The NPV would not go into effect until states totaling an electoral college majority had adopted it, and presumably not until Congress approved it, as the Constitution requires. Will you vote to join the NPV compact? Why or why not? We'll start with Senate District 6 and then move through. So Marianne, I guess you're first up on that, and we'll alternate as we move through questions in terms of who goes first for each district. So Marianne.
Great, John. What a way to start the night. Good Lord. Jeez. I will start out by saying that I totally support the Electoral College. Maine is a small state, and what my concern would be is that if we did not have the Electoral College, we would not have a fair shake in the presidential election itself. California would have decided it, all of the larger states would have decided it, and Maine's vote would not even count. So I will not support the national popular vote. I totally support the Electoral College, and I think we need to continue to do that to be truly represented across the United States.
Thank you, Marianne. Jeff?
So I'm totally conflicted on the issue. As a believer in the Constitution, I like the concept of one person, one vote. People of Wyoming have 70 times the voting power people in California have. So that strikes me as being somewhat unfair. On the other hand, we live in a small state, and I agree with Marianne that our 4 electoral votes are what keep people coming up here. The kind of 200 or 300,000 votes, one way or the other, are not going to make candidates come up here. So I'm totally conflicted, and I would have to study the issue. But my inclination is to vote against it.
Thank you, Jeff. Kim, you're up next on this one. You need to unmute yourself, Kim. Okay, sorry.
I had to find my mouse. Yeah, I moved it around. I am all for the Electoral College. It is part of our history. It has always worked. It's not broken. Why change it? It's not broken. It's never failed us. So that's all I got to say. I want to keep it.
Okay, thanks, Kim. Will, you're next up, and thank you, you're unmuted. Good.
Well, yes, thank you for that question. I also oppose the National Popular Vote Compact. I think Marianne brought up some great points with it. I think Mr. Levitt did as well. And his conflict was the conflict that a lot in the legislature had. There were a lot of folks who had to go back and forth on the issue because they were genuinely conflicted. about the pros and the cons. But coming from a small town and coming from a small town background where people say is quite limited, I identify with that, and I do believe that I want to hang on to Maine's 4 electoral votes. And I believe that we need to do that, and I believe we should apportion them into, as we're doing now, by each congressional district, with the winner of the state overall getting the majority. Thank you.
Thanks, Will. Ann, and then Mike.
Okay, I have voted for the compact, and I will tell you why. Partly because I do believe in one person, one vote. And if you look at all the rural areas, they have weighted votes. If I lived in California in a rural area, my vote would mean less than it does in Maine. And I do think that that is a kind of elitism. And I do have a problem with that. However, how they're going about is really to bypass the Constitution in order to have that happen. The one thing I do like about Maine is that the popular vote goes according to CD. So even as we look at this, there's a separation where a good portion, and I think most of the states, it is all of the electoral votes go to what the popular vote is for that state. And that is just as unfair. And so I do have a problem perhaps with how the compact is going, but I do firmly believe that there should be one person, one vote. Why should I have more say than the person who lives in a different area? Thank you.
Thank you, Ann. Mike.
As I mentioned before, I'm a believer in the Constitution, and I believe that the national popular vote is, like Ann said, a way to circumnavigate the Constitution. Article 4, Section 4, pretty much guarantees us a Republican form of government. And I believe that the national popular vote is a way to do away with that. It's a way to take the sovereignty of a state away and take that vote and force it onto a compact with other states that may not see what's best for Maine. The people of Maine know what's best for Maine, and I believe in state sovereignty, and I believe that our electoral college votes should stay in Maine, not be pushed off onto another state that is part of a compact that won the way. We are the 50 United States. We are 50 individual sovereign 50 states, and each state has a say in how it should be run, and they are tied to our congressional districts. So I believe it's a fair way of doing things, and I think it should stay the way it is.
Thank you, Michael. Kathy, and then Don.
Try to unmute myself here. Yes, I've definitely voted against the national popular vote, and I will certainly vote against it every time it is brought up. I heard from quite a few people in our district concerning this bill, which I absolutely greatly appreciated, and I respect hearing from everybody. The Electoral College is ingenious. And historically speaking, when we look at what our founding fathers did in the writing of the Constitution, the way they set up our Republican government, it is absolutely phenomenal. And I'm so thankful that we get an opportunity to have an electoral college and to be able to defend what the Constitution says how our executive branch is chosen. And so I will do that every time that it is brought up. And so I know that a lot of people, I've heard this, tonight, the one person, one vote issue. And for me, find that a little bit interesting. And I'm going to bring this out. Everybody can respond however you so choose. I think that's a little bit hypocritical when we talk about even bringing in this ranked choice voting issue that we are dealing with in our state. People that are for the national popular vote. They use this argument of one person, one vote. And yet for those of us who are against ranked choice voting, it's for that very reason. It's not one person, we believe in one person, one vote, but the ranked choice voting is like getting 4 or 5 different votes. So I find that a bit ironic when people use that in reference to national popular vote. So yes, I voted against it, and I will always vote against national popular vote.
Thanks, Kathy. Don, and then if there's anybody who wants to respond to that, or I'll let an additional comment in, but I want to let Don get his response in. Go ahead, Don.
Thank you. I am like Jeff, I'm conflicted on this. I hear what my constituents or what my friends are saying here on this panel, and it's nice to think that you could do one person, one vote and have that count in a national election as well as just in your town election. It has become more and more complicated through the years, and so we have what we have now, and it does bring consternation on both sides of this issue. If there's a middle road, I would like to see that worked out a little bit more than having a one or the other. I would like to try and clarify something, at least in my own mind, that our Constitution set up a republic, not a Republican government, and therefore it's a republic democracy. And that means that everyone gets to participate in this. And that's really where I'm coming from. Everyone needs to take their responsibilities as well as their rights, because they all claim the rights, but there's a lot of responsibilities built into the Constitution for the individual. So everyone has to participate. Thank you.
Thank you, Don. Did anyone else want to make any comment on this one or on any of the responses we got? Well, there'll be plenty.
Sorry, John, I'm sorry. Just let me real quickly just say, when I said Republican, I did not in any way, shape, or form mean the party Republican. I simply was talking about the adjective of being, a republic. That's all. I just wanted to clarify that.
John, can I jump in here?
Who was that?
This
Jeff?
is Michael, sorry.
Oh, Michael, go ahead. Yes.
Yes, when you read the Constitution in Article 4, Section 4, it specifically states the United States shall guarantee to every state in this union a Republican form of government. It's not talking about the party. It's talking about, like Kathy said, the form. And it's not, when you start getting these ranked choice votings in, that's forcing a democracy upon our government. And that is specifically against Article 4, Section 4. When you force something to be a 50% plus one vote, that goes against what the founding fathers had set down.
Thanks, Mike. I'm going to let Tora in here. Tora's prepared some questions, and go right ahead, Tora.
Sure. So, and we will get to audience questions. Also, remember, you can post them in the chat on the YouTube video feed. So feel free to post them there. And we already got one question. We'll get to that pretty soon. So I'd like to ask the candidates about their thoughts on the recommendations coming out of the Governor's Climate Council. I've been part of a working group and have attended each of the Climate Council meetings, or most of the Climate Council meetings. And a number of folks from the Down East region and some of the more rural parts of the state have expressed some concern about equity between the urban and rural parts of the state in the recommendations coming out of the Climate Council. And the Climate Council also has identified a lot of kind of hot button issues that may be very much of concern for Down East regions, like effects that are already impacting tourism, fisheries, agriculture, et cetera, that are important for the Down East region. And so my question to you is how you plan to follow through in Augusta with the Climate Council's recommendations. What would your priorities be? And what are your thoughts on the recommendations coming out of the Climate Council? And I believe we begin with Kim. Sorry, I should have given you a heads up, Kim.
Yeah. Especially seeing as the Climate Council, I do not really know a whole lot about what is going on with that issue. I have to learn a lot about what's going on in Augusta before I can really give a fully informed opinion. But I will be very, very, very right into it, because obviously it's something I need to catch up on, because I've always known there's an issue with our climate. You know, things are changing, evolving all the time. What the actual cause of it is, I don't really know. Nobody's really pinpointed to a definite what has caused all of this. You know, is it the businesses that are causing the most of the ozone issue, or is it something else? So all I can say on that is I have to get fully informed before I can give a valued opinion.
Thank you. And next up is Will,
Okay.
and then it will be Anne.
All right, well, thank you for that question. Several things crossed my mind in answering it. The first one is, I think we really do need to listen to the communities most affected. And one of the communities most affected by climate change is the fishing community. And the fishing community is very serious about climate change as the Gulf of Maine warms and lobster migrates, and not just lobster, but other fisheries as well, and new fisheries come into the Gulf of Maine. I think we really need to listen to the fishermen. I think we need to listen to the people who make a living on the land first and foremost. And I think we need their input. And if there is, and I'm not saying there is, but if there is sort of a divide between more populated areas and rural areas, I think we really need to flesh that out and vigorously debate it in the legislature. I know for myself, I've always tried to represent fishermen in our area, whether it be getting expanded access to the gray zone or whatnot. And I would carry that forward. I have a lot of good friends in the fishing industry, and I would certainly talk with them first, because the fishing industry is a lot of where it hits us. It hits us in other ways, but really the biggest way, the most obvious way, is the fishing industry. Am I out of time?
Thank you, Will. And next up is Michael.
I thought Ann was next.
It was my bad, and John gave me a heads up. I was supposed to flip incumbents and challengers this round.
You know, so like what was brought up is excellent question. There's two sides to this debate, and I think personally, I know that the climate is changing. There are things going on in this world that do cause the climate to change, and it's something that we have to take a serious look at. But I don't think the science is 100% behind that, because we haven't figured out exactly. There's a lot of theories out there and stuff that we, you know, being in college, we write a lot of papers, so we've touched on this. But to force the United States to, or even the state of Maine for that matter, to succumb to the federal or the state mandates to reduce carbon emissions, while the rest of the world is not held to these same standards, is something that we just can't do. It puts a handicap onto us, to whereas we are behind on the other countries that aren't hampered by these regulations and laws. So, you know, I do agree that there is the climate is changing around the world. I see it right here in Maine, like Will had said with the fishermen. The fish are going out deeper where the water's colder. The lobster are going where the water's colder. We see this, we know this, but we need to look at it more, and we need to look at it seriously and take politics out of it, and say, you know, what's going on, and we need to work together to find a common goal and a common ground to fight the climate change.
Thank you. Anne.
Thank you. Yes, well, I think we all agree that climate change is happening and we are seeing the results of this. I agree about the fishing industry, and I think we have to be, in looking at what the Climate Council, because I don't know what the recommendations are, but definitely to become better informed, and we have the ability to do that while we are in the legislature. There is caucuses that really help bring people forward to give us the information that we need to make the kind of decisions that we need to make. And that is going to be very important to continue as we move on. But the climate is changing, and we've got to be able to plan forward so that we are able to really stay viable and plan ahead, as we know we're not going to be able to fully change what's happening, but find ways to work with what's happening so that we are in a better position and not racing behind trying to catch up with what's happening with the climate. So my best way of putting this is we really need to research it fully as the recommendations come forward, and really try to work with all of the people who are affected by this, and try to be as imaginative and forward thinking so that we are not chasing behind, trying to catch up, and finding that we're in worse shape.
Thank you, Anne. And Don Greene.
Thank you. I had to find my unmute button. This is something that I've been following since I was a young fella. I was in the Boy Scouts, and we really learned about nature a lot back then. And climate has been changing all throughout Earth's history, but it has changed over millions of years. Now we are looking at climate change, which has happened within the last 150 years due to man's activities, whether it's the individual or corporate bodies. They have affected the climate. And we as individuals first must accept the personal responsibility to make changes in our own lives, drive our cars less, use less plastics when possible, and so forth. All the little things do add up. And when more people take the individual responsibility to be responsible for making those changes, then changes happen. Yes, we have a state body which is looking into climate change and all of the big things that are happening in Maine, but the little things are happening too. And that's where we as individuals can have the greatest impact. So I think that we have to educate ourselves. We have to educate our fellow Mainers as to what they can do on a personal level, and then from there move it up into what they can do as corporate bodies in their towns and so in their state as a whole. Thank you.
Thank you. And Kathy Jabner. You're muted, Kathy. And I'll restart the timer. So.
My next question back to you was, were there any specifics of the recommendations that you wanted to ask about?
I'm primarily interested in the recommendations around, fisheries, forestry, agriculture, the things that are our bread and butter in this region.
Yep, absolutely. Great. Thank you. That has been one of the greatest things that I've learned on the Marine Resources Committee was how it affects the fishing community. And I've appreciated that greatly. And also, as well, the logging industry, as you say, we all want the logging industry to continue. So of course, we want to do what we can in order to preserve that. Those are our traditions. many kids in our area, they grow up and that's what they want to do. They want to get their CDL license and they want to drive truck in the woods. And so they want to drive skidder, and it's going to be extremely important for us to all work together to make sure that that continues. And so I have been really impressed and amazed at some of the very practical changes, that we can make. The education is extremely important, for us and especially the logging industry, on how we can make things more efficient for forest management. I think that's really important. We've seen a lot of improvements in those areas, and I'm really, really excited about that. I think that's great. I think we need to look at the positives in the change that has been happening already. I think, Mainers, we love our way of life. And so we want to do what we can to preserve that. And I think that's really important as we work together as communities, educating and really just showing and teaching respect for our land, for the fisheries, for the coast, for the forests, everything that we have that is just so amazing in our state that makes us us. I think that for me as a legislator, I think that as I talk to my constituents and my neighbors and my friends, they all want to know how, what we're going to do to preserve that. And I think we're all willing to make those hard decisions and to move forward. And so that's what I look forward to most in this next legislative session is we're going to have some hard decisions to make. And so it's going to be important for us to all work together for that.
Thank you very much. Next is Jeff Lovett.
So being on the coast and representing fishermen and pound owners, I was shocked, and I hope, Tori, you could confirm, when I read that the Gulf of Maine waters are rising faster in temperature than 90% of the other waters on Earth. Now that's a scary fact, and we're going to have to deal with it. But we're going to have to realize that the movement from fossil fuel to alternative energy is going to happen without us. California, for instance, has mandated zero emissions vehicles by 2035. When that happens, the price of electric vehicles are going to plummet, and the price of gasoline and diesel engines are going to go up. So we're going to be an electric economy. And this gives us, instead of looking at the negatives, I would like to look at the positives. We here have a great opportunity with offshore wind, with tidal projects, with wind, land-based wind, and with solar. And we should utilize these because these are assets we have for not the economy that we have now, but the economy we're going to have in 2035, whether we like it or not.
Thank you. And then last but not least, Marianne Moore.
Wow, to have to follow all of those folks, right? Actually, and I did serve on the council with Tora, and I was actually working with the public health part of it, not the fishermen and the logging part of it. So that was really what I was more familiar with that. I know that there's a lot of hard work that went into the council's work, and the recommendations are great. They're quite fluid, and in the fact that there's some fiscal notes that are involved. It may be quite expensive. It is going to be a matter, as legislators, we are going to need to set priorities. And I think, Kathy, you're right, in that we need to look at our forestry, our fisheries, our logging, and we realize that our forests have a lot of carbon. They're keeping the carbon, they're using the carbon, and so that's not quite as bad. But we do need to look at the water temperatures. I also participate in the Gulf of Maine New England task force, and that's something that all of the New England states are looking at, is the temperatures of the water, and looking at our tidal and the wind and different things like that. So I think as legislators, it's going to be very, very important for us to become very familiar with these recommendations, to become knowledgeable about it as we start looking at what prioritize, what bills do we need to act on over the next couple of years. It's not something that we're going to be able to do overnight. As Jeff mentioned, there's a lot of goals for 2025, 2035. And that's, I think, what we're going to have to do as legislators, to set those priorities and make sure that we protect the environment that we have here in Maine.
Thank you very much. Thanks to all of you. And next, I believe, John, did you want to ask your question, or you want to go to the question posed by the?
I think we should get to the public.
Yes. So we have one question and one comment. So we'll start with the question. Myra Ekis writes, "Why are health insurance premiums so high in Washington County?" And I believe we're going to start with Will Toole, and next will be Ann Perry.
Well, thank you for that question. I will say healthcare is probably not my biggest forte, but I know a lot of it. I'm going to take a stab, and I think a lot of it is our geography and the fact that we are having to go to other places for treatment. If you have to go to Bangor for cancer treatment or what have you, that's one of the reasons the cost of healthcare is so much more expensive in Washington County. I also think part of it is Washington County isn't as healthy as the rest of the state. And I know Marianne and Kathy and Ann can probably touch on that a little more, being on HHS. We're blessed to have 3 folks from Washington County on the HHS committee. But I think that's also part of it, that people in Washington County aren't, the general overall health of people is not as great as it is in other parts of the state. And that is tied into income and lack of job opportunities as well. So you have all of those factors driving up the cost of healthcare. That's a really crash course in everything.
Thank you, Will. And Ann, and next will be Michael.
Well, in my other terms, I had the pleasure of chairing insurance and financial services. So let's talk about rural areas. I think the difficulty is how insurance companies, because they are risk managers essentially, and what they look at is access to healthcare. That's one thing. And in the rural areas, access to healthcare is more limited. It is not easily accessed. It takes longer to get to the healthcare institution wherever it is. And so this is something that we call community rating. And as a result of that, the community rating then increases the price of the insurance in that area. Another thing that also adds to that is age. So we have an older population. And again, with the risk, the older you are, the greater the risk. And so with age and accessibility in terms of distance, that adds to the cost of an insurance premium. And then you look at the health of the area. And then you've got another little thing that happens that brings that price up. And what the Affordable Care Act has tried to do is to mitigate that so that the rural areas won't have such a large difference between that, which means they put some limits on how far you can go in terms of community rating to raise that up. Doesn't mean that doesn't happen at all, but it happens some in all of these things. But really, the fact that we're rural and that we're older are the 2 biggest factors.
Thank you, Ann. And next up will be Michael and then Kathy.
Excellent question, especially here in Washington County. Like Ann said, everything she said hit the nail on the head. The premiums increase because the demand for medical service increase. There's more use of Medicaid and Medicare, which drive up the prices because they pay less, so the other people pay more. They're all based on government contracts and guaranteed pricings. multiple systems. We have hundreds of systems here across the country, and multiple systems generally will create waste. Drug prices are going through the roof. That's another thing that will raise up our prices. So we need to work on getting the drug prices down, limiting big pharma to, you know, what we have to pay for medicines. The doctors, the nurses, the paramedics, you know, they're all being paid more. We're being mandated to raise minimum wages as business owners, and that's going to be passed off to the consumer, sadly enough. Hospitals, a lot of them are for profit. You have a lot of nonprofits, but most of them are for profit. And the healthcare practice is, you know, a defensive. So nobody who's healthy goes to the doctor and says, hey, what can I do to prevent this sickness? So when you go to the doctor, you're sick and you need help. So now they have to figure out why. And across the country, prices are varied widely. So healthcare across the country is different. Out here in Maine, we get different issues than what they get in, say, California or New York or Washington or even the Midwest. So, you know, all of those need to be taken into consideration when we look at the healthcare prices. And that's something that the legislature could do to try to mitigate what we as Mainers are paying for healthcare in the future.
Thank you very much. And Kathy next, and then it will be Dawn.
Great, thank you. I'm thankful for Representative Perry's great experience with all of that, because I didn't really know that yet. So I was like, that's great. It's very unfortunate, you know, that because we love our rural living, but like we've heard, a lot of that, it comes with a cost, you know, as we try to keep ourselves healthy. And if we're not, the prices are raised. And so that's just extremely unfortunate. And it's not the best, obviously. It's not the best services, you know, that we get. I've been asked this question quite a bit, you know, what are we going to do to try to help our rural hospital systems even? And it's difficult, you know, as we are an aging population in our state even, and, you know, we try to be healthy and try to be the best that we can, but also provide those services that our population needs in the rural areas, and our elderly people, and you know, educating our young people on how to stay healthy. And so it's unfortunate that the premiums are higher, and it is something that certainly needs to be looked at. And so hopefully that can be something that can be a priority in this next legislative session, perhaps, and maybe even something that can be looked at with the federal delegation as well. So I think we can work on that together.
Thank you. And so next is Dawn, and after Dawn will be Marianne. Dawn, you're muted.
Oh, okay, we'll try this again. I have to look at this from the perspective of a firefighter and an emergency medical technician, an instructor for emergency medical services. Also, my association currently through hospice with Down East Community Hospital and Calais Regional Hospital, both small community hospitals. Unfortunately, the cost of healthcare in Washington County has been high and will continue to remain high for all the reasons which Ann pointed out. It is an aging population, and I think that what we really need to look for in a rural situation is more of the type of facilities like Eastport Healthcare and Lubeck Healthcare, where the communities can go right within their own towns to get healthcare. And then if it needs to go to the hospital, we move it up. The problem there is that many people are not associated with a physician. They have to go to an emergency room, and you walk into an emergency room and you immediately incur $1,000, $1,200, $1,500 charges. So we need to, again, educate the population to get their own physicians, to begin to take care of their own health. In other words, be personally responsible for my personal health, which means getting to see a doctor every so often and not only in an emergency situation. So healthcare begins with how we eat, where we get our food from, and so forth. So healthcare starts in our home and proceeds upwards. We can't force it the other way. We can't go from the top down. We do have to look at those costs, and we do have to be aware of them, but we do need to look at the small end of the scale as well and do as much as we can from that position. Thank you.
All right, thank you. So we'll go to Marianne, then Jeff, and then finally Kim.
Here we go. Yes, Anne, thank you very much for explaining that. It's almost exactly like when you talk about your car insurance. I think it's all based on the same principles that go with that. But definitely affordable quality healthcare has always been a priority of mine. And living in rural Maine, it is a struggle having access to it. I know as a trustee at the hospital, we struggle to find a primary care physician. As Don was mentioning, people are struggling to find doctors. If they are associated with a federal health center such as Lubec or Eastport, they work with the staffing there. But if you don't have a primary care physician, you don't have anyone to go to. So I think that's something that we're going to have to work on. And maybe it's the reimbursement rates that we need to address in the HHS committee or the insurance committee so that we can attract doctors and make sure that we can afford our hospital, that the hospital can afford to stay open and not charge the higher prices, which is driving up the cost of our insurance as it goes along with that. So it's all of those that are so important, and especially in rural America, rural Maine. What I also get concerned about is that everybody thinks that because we live in rural Maine, the quality of our healthcare is not as good as going to Bangor or going to Portland or going to Boston. And as a result of that, we see that everyone drifting away from that. And so consequently, our services are not being used in rural Maine or in Washington County. And so we do see that drift. And I think that causes a lot of times for the costs to go up as well.
Thank you very much. And Jeff?
So if you look at health insurance, it's an interesting exercise to go on Anthem's website. And for a 50-year-old with a family, and the difference between putting in a Portland zip code versus putting in a Machias zip code. So there's a lot of policies in Portland you can't even buy here because they don't even offer them. But for the ones that they do offer, our premiums are 50% higher. So, I think we have to look at where insurance started. And insurance started that we were going to take individual risks, and it started with fire insurance. And we're going to spread it out into the community. And the reason for that is 4 or 5 houses burn down, but hundreds remain the same. So we spread the risk among all house owners. Well, there's nothing magic about community rating, and we didn't always have it in Maine. So we could switch to someplace like some system like Vermont, which has statewide rating. And then we would pay the same here as they pay in Portland. So that's one thing that we could look at and should look at.
Thank you. And last but not least, Kim.
Well, after going through cancer, I kind of have a insight on the insurance and how things work. I've had a couple of different ones. It definitely makes a difference whether you can find a doctor that is in network or outside of network. And it makes a difference whether the doctor's office knows how to process your insurance at the same time. Because I had a lot of issues where I had to file my own claims because the people in the doctor's office didn't take that type of insurance. So there's a lot of areas in the medical field that could use some work, not only in the insurance side of things, but in the medical field itself on how you receive services. You know, when this COVID thing came along, all my appointments got kicked out. You know, I got put on hold. Whether I've had dental insurance this whole year and have not been able to use it. You know, luckily I finally got into the eye doctor, so at least I can see. If all else fails, I can see. But yeah, there's a lot of issues in insurance and in the medical field. You know, I know people who are on kidney dialysis that there are prescriptions that they get that it's astronomical. How can you afford to live? You know, when, you know, there's just a lot there that I won't go into at this point, but I definitely want to be involved in trying to make some changes.
Thank you. And are there any remaining comments on the question? Okay, Marianne and Anne. So first, Marianne.
Just one of the things that I think was that has been good that has come out of the COVID-19 situation is the use of telehealth. It has been priceless, at least for us here in rural Washington County. Before, the telehealth was very rarely used, and when it was used, we weren't being reimbursed for it. And so it was discouraged. People were discouraged from using it, or the doctors and nurses were discouraged from using that. So I think with the increased usage of telehealth, we will see some improvements to the healthcare that we are getting, because we are able to now connect with experts that are located perhaps in Portland or Bangor or in Boston without having to drive that distance too. So I'm optimistic about the use of telehealth and the reimbursement rates that we are seeing as a result of that.
Thank you. And Anne, you said you had a comment.
I do have a comment, because some of the things that working in a practice that we've had to deal with, and it's made it very expensive to be able to get paid, is because insurance companies have different insurance companies have different rules. So is Medicaid and Medicare. And so when you're billing, if you know, there's no one thing. I think we have all these lists of things, and if you pick just one number off or one list off, they won't pay you. So you have to go back and reapply. This is what the offices go through in terms of doing this. And I must admit, now I'm going to give my age away, because in the 70s, I worked in a doctor's office, and I was the nurse, and there was the doctor and the receptionist, and those were the only people in the office. Now, in the 2000s, I worked in a doctor's office. There was myself, the doctor, we were the two providers, two nurses, one nurse for each of us. There was a receptionist. There was the business person who did all of the insurance stuff. There was somebody who had to do prescription renewals and referrals, because those had to be done very specifically according to the insurance company's requirements, and one to file all of the records that we had to keep. We were having trouble making it. And we had to keep all of those other people in order to do the stuff we needed to do to make sure that we were staying kosher. So what we did is we let go of one of the nurses. We're a medical practice. So now we had a nurse between two providers. The difficulty is we have such a convoluted system. And this system is paying for all of these auxiliary people, as well as the provider that you see. And that's been a piece of the issue that has come with the increased cost of healthcare.
Let's see, and I think Jeff and then Will.
So building on what Ann just said, I'm always amazed that MasterCard and Visa card can deal with millions of vendors, tens of millions of users, and the bill is always right. You know, maybe in the last 40 years, I've had one or two wrong entries on my credit cards. How is this possible? How is it possible that all of these vendors that sell millions of different things get it right, and our medical system cannot get it right? I just don't understand it.
Well, I think Will is next, and we can come back to you, I think.
All right, so sitting and listening to everyone, I know somebody earlier mentioned the health centers that we have in Washington County, and that brought to mind that every year the delegation goes down, I think it's usually to Eastport, when we sit and have a breakfast with the healthcare providers in the area and listen to their issues and concerns. Usually that happens in December, and we're very fortunate to have folks like Marilyn Hughes and the folks at Eastport and all of the centers in our area, as well as the hospitals that are there to advise us. And they will, you know, if we have a question or a concern about a healthcare related issue, we can reach out to those folks. The other thing I want to mention about the cost is the toll of drug addiction and substance abuse. That comes with a lot of health issues related to it. And I don't know if we fully have our arms around how much of a cost that is yet, but it would be really interesting to see. And as we deal with and get resources into recovery and helping people break their addiction. So I think that's another important thing as well.
And John, are we allowed to let Ann have one more comment? There you go, Ann. He says yes, and he's the grand poobah.
Because with Visa, you only have the price of the product you paid for. With healthcare, I have to, when I see a patient, define the visit itself, do all of the diagnoses, and then the insurance company decides whether they're going to pay for these. And if it decides that it's not in the right category, then they discard the bill and we have to redo the whole thing all over again. And it has to match what our note says and all of this stuff. If it were as simple as Visa, we would be a lot better off.
Thank you. My husband's not here to wrangle the dogs, so I apologize. I want to say one thing to our audience, shush, which is that please frame your questions, your comments as questions. We do have another question, and maybe John, I'll ask you to take this one, and I'll see if I can wrangle my dogs.
Okay. So I think you're referring to the question from Andrea Guerra. I'm sorry if I didn't pronounce that correctly, Andrea or Andrea. Would expanding broadband help with healthcare and virtual visits? And I think we start with Mike and Ann first on that one. So the question was, would expanding broadband help with healthcare and virtual visits? And I know Marianne spoke to this briefly already, but go ahead, Mike.
Well, Andre, I want to thank you for throwing me that, what we call a mush ball in the softball game. Healthcare would benefit immensely from a higher and faster speeds in the internet world. You know, we out here in Calais and Baileyville, we have fiber optics coming in now. That was a citizen purchased and put in product. No tax dollars were paid for that. We're hoping that it works out well for us, but yes, you know, in a nutshell, yes, expanding broadband would help the healthcare and the virtual visits. The problem is out here, like in Charlotte, we'd have to go 14 miles off the main line to pay for it to get out here. And there just aren't enough citizens out here in Charlotte to make it economical for us to bring it out here. So it's one of those things that we probably need some state funds to supplement to get it into these smaller rural towns that are off the main lines of these arteries that these other companies are building and putting in.
Thanks, Mike. And Ann,
Okay, first of all, and I think Marianne had mentioned it, reimbursement does make a difference on how well that works. You know, because if the reimbursement really does not cover what the actual cost of the visit is, unfortunately, it does increase the cost to others who have coverage. And that is an unfortunate thing. But, I'm going to say but. The good thing about telehealth, and I think that it is something we really, really need to make sure it works, it does two possibilities. First of all, if we're really going to cut the cost of healthcare, we have to cut the cost of emergency room visits, of people waiting until they're sick to come in. If we can catch them to prevent that level of illness, then we're spending a whole lot less on healthcare. And that fact that telehealth comes in a couple of different ways. I was actually in Yonkers, New York Hospital to see how they use telehealth, which was fascinating because they would have their diabetics and they had something they could put up to the eye to look at the eye, and they could directly send that to an ophthalmologist to determine at that time whether there was a need for a referral. And it really, first of all, it helped with prevention of having to wait for that. It also prevented an unnecessary referral that would cost more. And so I think there is a lot of benefits that come and could come, besides the ability for people who have trouble getting to an appointment to actually get the health care that they need. I'll quit because I could go on forever.
I see Robert Alley has joined us. Robert, I know there's a little lighting issue. I'm gonna, so we're having some discussion. As soon as I run through this group, I'm gonna let Robert in. Next is Don Greene and Kathy Javner. Don?
Okay. Yeah, this is a continuing discussion in Washington County, is how to get broadband into the rural areas. I'm currently had to go with Axiom. I had to pay an additional $1,000+ to get a link through the air with a dish on my house to a dish that they have on a pole about a mile away, so that I have high-speed internet. So I had to pay extra to get it. There are a lot of people who can't pay that or wouldn't pay that. Internet is available, obviously, through satellite, but again, you have to have a link up for that. And that doesn't work during a storm or if there's other problems. High-speed internet in any land-based form is expensive, and how to make it work. I think Calais and Baileyville have taken a giant step forward in being able to move forward on a community-wide basis to get this done. And to me, that's really how we have to do it in rural Maine. We have to find our solutions, work toward those solutions, and get it in our back pocket. We would not be able to do what we're doing right now without internet connection. Telehealth, as part of that, gives us the wide range. We could be talking to a specialist in California, in San Francisco, in Dallas, Texas, or in Hong Kong. It doesn't make any difference. Telehealth brings us right to the office. If I get an x-ray in the hospital, it isn't interpreted at the hospital here in Down East Maine. It goes to somebody someplace else. I don't even know where they are. And they do it by telehealth and then send their report back. It's part of what we're doing now. We've gone a long way from a crank phone on the wall to being able to do what we're doing today. So communications, our ability to talk with one another, hear how things work, how someone else has an idea of how they can work better. And this is what we need to be doing. And that's why I'm involved in this. So thank you.
Thanks, Don. Kathy?
Great. I will admit that I was not a big fan of telehealth. Personally, I would like to go back to having doctors come to our houses to visit and do their doctor visits there. But as I sat through HHS and we heard many, many different testimonies about telehealth, I was on board a little bit more. And yes, obviously the broadband is a huge issue, not just for telehealth, but as we've seen for our educational system. And I don't want to break off into that subject right now, but that has been huge. So I'm a big Starlink fan, and I'm waiting for Elon Musk to get those satellites up in space so that we can all link into Starlink. But until that comes, Alexander has been an amazing example for the community to come together for broadband, as you've said in Calais and in other areas. And I have been telling people of all the municipalities that call me about their lack of broadband, I say, call Alexander, because they know how to get it done. So I've been encouraged by that. And with the whole telehealth issue, I know that it's going to be something that we're going to have to move towards in the rural areas. And so, yes, broadband is a major aspect of that. And it's complicated. I in Chester, we don't have internet even. To my son's detriment, you know, he's like, Mom, I can't believe we don't have internet yet. And so it's a big deal. And we've been working hard in the legislature and looking at different issues and how to make that happen. And so there's a lot of different things. Municipality owned broadband, the bond that was passed, not quite sure how all that's going to be paid out, but I'm going to follow that very closely on where those funds are going to get set. That has been said that it's going to be for rural areas. And so we're working hard at making sure that that actually gets to the rural parts of the state. So.
Thanks, Kathy. We have our Senate candidates now, Jeff and Marianne, then Kim and Will Toole, and then I'm going to let Robert Alley come in after we finish this round. Okay. Jeff, I think you're next.
Thank you, John. So obviously, telemedicine is the wave of the future. You know, personally, I have 2 appointments with doctors down in Boston. I'm very happy that it's going to be in this chair rather than in my car seat for 13 hours going back and forth. So, you know, telemedicine is going to help law. It's going to help, you know, any business is going to be benefited by high-speed internet.
Marianne.
I agree, definitely. The broadband expansion is very, very important. I know the conversation, in fact, I had a long conversation this afternoon from someone in Sullivan, and we were talking about how important it is that we do get that broadband to our smaller towns such as Sullivan and Goldsboro and some of the different ones there. And I think the thing that we want to do as legislators is make sure that we are being equitable about how we are spending the monies on that. Let's not just throw it out there to copper and say, okay, let's give them DSL. We need to be wise in how we are spending that money. Working with Connect Maine Authority, they get it. They understand how important it is for rural Maine for us to be able to get broadband to the areas that are underserved or not served at all. And so I think as legislators, that's what we need to do, is hold them to the line and really pay attention to that. Another thing that's been creeping up the last couple of days in conversations is really addressing the Public Utility Commission and really looking at, I don't know that they're on board with it. I think they're still antiquated and they're still looking at the landlines, and they haven't moved ahead to say, where are we with broadband, and allowing companies like Spectrum and some of the other non-Bell system companies to be able to do some things on the poles without having to get an act of God to make it happen. So I think as legislators, we really do need to take a look at that and work closely with Connect Maine Authority, and also take a look at the Public Utility Commission with the goal of getting broadband out to our underserved areas for sure.
Thank you, Marianne. Kim, then Will, and then Robert Alley is going to join us. Kim?
Okay, I'm excited about this one. This is something that I know about. I know about broadband. I know about high-speed internet. When I was in New Hampshire and I went to school, I wanted to learn the best of the best when it came to computer technology. And I thought I was way over my head, and I even told the instructor that, and he's like, oh no, it's not as hard as you think. And it wasn't. And I just love it. The things I can do on this computer, the things that I can do with business, you know, I just think it's great. The telehealth, I think it was also great, but I gotta say, I still like going to see my doctor. I like the personality behind it. I like to know the face-to-face, the eye contact, you know, what am I facing? I wanna know. You can't get that from telehealth. I'm sorry. You know, if you really need to talk to somebody, then yeah, I can take a picture and show you, you know, what my rash looks like, and you can tell me, you know, what would probably take care of it. But you're not going to get an as accurate diagnosis as you will if you go to see your personal doctor. So there's a place for telecommunications and there's not. So.
Thank you, Kim. Will?
The short answer to the question is yes. I think expanded broadband access is essential to expanding telehealth. And someone earlier mentioned about the whole climate situation and how if we spend less time in our vehicles, you know, wouldn't it be great? That would help the climate. Well, this is one practical example of how if we spent less time in our vehicles, and we're able to do some things more and make telehealth more widely accessible. I think it's getting there. I think the pandemic has caused people to have to rely on it more. Maybe we're not at the perfect comfort level yet for everybody, but I think as we go forward, we're going to increase that. And I think just Zoom was a novelty a year ago. It was around, but it was a novelty. And we're all generally on it. I mean, maybe with a little bit of duct tape and wire, but we're all on it. And I think that's important that we're making those strides. And I think we can make more with investments. As I said earlier, the legislature this past year did a bill to take revenues from telecommunications and drive that into broadband. The question that we all want to know is where's the money all going to go? And that's a little harder to get your hands around. I know the Connect Maine Authority is trying their level best to spread it around, and they have historically, but it's still kind of hard to wrap your arms to where that money is going, what they're going to do with it, and how they're encouraging investment. I would say though that they are doing it. Certainly Woodland and Calais are an example. Addison is Alexander is an example. And another good example of that is Roque Bluff and what they're doing over there, a small town of a couple 300 people that is spread out over a bunch of peninsulas. They're making it happen there. So we have some encouraging signs, but certainly I think broadband, as the state continues to invest and expand investment, I think that's a good thing, and we need to continue doing so and continue to encourage that. And that's one of the things as a legislature we've been able to do bipartisan. We've had some bumps in the road, but you know, we've put those differences aside and we've rolled up our sleeves and dug deep, and we've bridged the gap. And I think we're going to have to continue to do that in order to move forward. Thank you.
Thank you, Will. Now, Robert Alley, the other UMM grad here tonight. Representative Alley, I'd like to give you a couple minutes to just introduce yourself to the crowd and we've had a number of questions. I don't even know if we'll have time for another round of questions, but thank you for joining us. And why don't you give us your introductory remarks? Okay. Remember to unmute yourself.
I can unmute you.
Oh, okay.
Oh, no, I guess I can't. So, yep, there you go.
I'm unmuted now.
There you go.
Yes, I'm Robert Alley from down at Beals. I've been in the State House for the last 6 years and serving Districts 138, Jonesport, Beals, Columbia Falls, Centerville, Addison, Cherryfield, Millbridge, Whitneyville, Marshfield, and Jonesboro. And we have had some discussions on broadband. And in fact, the first bill that the governor signed was a bill I put in for, well, I was trying to get more money for broadband for our area, and it didn't quite work that way, but we did get enough money out of it that we could give it to the libraries, and they would split it up among the kids, and they worked on a hotspot, they called it, and it was educational, and it helped them with their education, and that's where I wanted it to go, was for the kids and their education, because who else is gonna help them if we don't? And yes, the Roast Bluff part of it, I am tickled to death that they went ahead and ended up getting broadband down there. And I was thinking that if that can be in Jonesboro, why couldn't they tether that through to Jonesport Beals High School or the grammar schools and down into Machias, and we could take and go back to the table and see if we can get more money this time. Then we've got it all, and I know it's on the roster to do. So hopefully we can get it done and put some big bucks into broadband and see if we can help the communities and the economy and the school kids. Hello?
Let's see, John, I think
Yeah,
you're kind of talking.
sorry. It's just about 8 o'clock. It'll take about 15 minutes to get through our last round of comments. So we could, if Tora had a question we could get short answers to, we could do that. I don't see any more public comments in there. So Tora, you have and we'll try to have short answers and move through, because I want to make sure everybody gets their closing comments. So Tora, do you have the question you want to ask, or?
Sure, I'll give this one. This might be a good short one. The question I have is, what is the single most important thing that the state legislature specifically can do to help Down East Maine recover from the challenges posed by the pandemic? So we've had a rough year. What is your first priority when, in a sentence, when you get to Augusta for helping us move forward? And I didn't even think of who's next.
I think Kathy Javner and Dan.
Okay.
Dawn.
Great, thank you. I really appreciate that question. I think it's extremely important. For me, it's the small businesses. We really need to get on board with being able to encourage and come alongside our small businesses and help them through the economic disasters that they have all been experiencing. It has truly broken my heart to see the many small businesses that have had to shutter their doors, and we really need to do whatever we can to make it so that no more small businesses are closing because of due to the economic hardships that have been caused through this closure and what we were experiencing. So I think that's really important.
Great. And Don?
I have to agree with Kathy on this one. Washington County needs to stop thinking about bringing in some grand outside enterprise that's going to save us. It's not going to happen. It hasn't happened in the past. It's not going to happen in the future. Where we excel is in the individual who works for themselves, their families, and their community. And those people own businesses. They are their own business, and they are out there promoting that business. Any way that the state can help them as far as communications, as far as being able to deliver services or to get things in or out of Washington County by means of transportation is going to be a boon to us. I remember driving through our District 141, Route 6 has continued to deteriorate. Route 6 is a main thoroughfare for much of rural Washington County. So the individual, the small business owner, the person who's working out of their house or their garage or their basement, who's making a difference for themselves and their family, this is where the state needs to concentrate, to reinforce and to lift them up and to be there for them, not some pie in the sky something that just, I mean, I've lived through all this and it just hasn't happened down east. It's not going to.
Thank
So
you.
let's support our people and get it from there on up.
And on to the Senate candidates, Marianne.
Thank you. Definitely, we have got to help our small businesses. So often and we saw this with the CARES funding that came in, and so much of it went to Southern Maine. And the poor businesses, yes, they were struggling, but here up and down East Maine, we had our seasonal businesses this was their livelihood, and they were having to close their doors because they didn't have any assistance to that. I was encouraged by the recent, the Economic Development Commissioner was talking about this phase 2 of some additional funding. They have changed it where now businesses that are less than 250 employees can apply. There's some good opportunities for childcare centers, for the small business owners, and that expiration day, or the applications have to be in by October the 29th. So those are things that we're going to have to address, I think, as legislators, to be sure that we continue to try to help, give them that help up so that they can continue, because we don't want them to shutter their doors. We need them to have their work. I mean, we have so many hard entrepreneur workers here in Washington County that I think it's important that we give them that assistance.
Thank you. And Jeff.
So I want to reiterate what everyone is saying about shopping at local businesses. So when you shop locally, the money recycles in the community 3 to 6 times, depending on which study you look at. So if you spend $1, it really, and then the person the owner buys gas in the local gas station, and on it goes. So shopping locally increases the amount of money available to everyone. When you buy something from Amazon, it goes out of state and we never see it again.
Thank you. Next is Kim.
Yes. Thinking about the small businessman, you don't want to forget the bigger business either. They're just as much a part of us as the small business guy. I think we need to look at all businesses, the self-employed, the small business, the large business. Everybody needs some help at this point. Granted, the smaller businesses are hurting more than the bigger businesses, but everybody has been impacted because of COVID. So we can't forget and let some of these other people slip through either, because if we focus totally on the small businesses, the bigger businesses are going to be hurting. And then what do we do? So we got to look at the whole picture. We got to look at everybody. We don't want people slipping through the cracks here.
Thank you. And Robert, Ally.
Yes, just a second. Yes, I go along with that. And for the most part, all of these businesses that are in our local areas need help. And even the bigger ones is on the border of needing help. It's a hard job for any of them to operate without funding. And what we need to do is make sure that they get the funding and get an economical, a good handle on it, on the economy, so that in a year or so, they'll be back on their feet running good, and the people that work for them will be able to get pay raises and feed their families. And there's not much more you can say about it. It's a particular situation with the economy the way it is, and not getting any extra funding. In fact, they take some of the outfits have taken funding away from some of them because they thought they might be getting too much, and they've got these programs out there where that you can hire a group of people, work them, and then when your business closed, where are they? They're back on the cold again. So we definitely need to get our ideas together and take care of the people that's right here in Washington County, probably before we do anybody else.
Thank you. And Will Toole.
So I think I agree with pretty much everybody who has expressed a desire to help our small businesses and our communities. Certainly the tourism industry has been whacked really hard with the pandemic. It's nobody's fault that the pandemic hit. It's nobody's fault that we dealt with it the way we dealt with it. And it's a learning experience for everybody. What I think we need to do going forward is we do need to work with the businesses and work with the chamber, and work with the advocacy groups and the small businesses. But more than that, we need to be more effective in communicating what resources are out there. And I think sometimes things get said and done in Augusta and rolled out with the greatest intentions, and they don't actually get to the ground. They get lost somewhere in the translation, if you will. So I think we need to do a better job getting that word out to people. The governor certainly has done some of that. The CDC, that business, that isn't necessarily their expertise, but we do definitely need to find a way to get the word out better and connect with people more, because the economy is critical as we move forward. The other part of that, responding to the pandemic, it's going to take experience. It's going to take people with bipartisan leadership qualities and willingnesses to work together. We can all sit here with grand ideas, and we all have grand ideas. So when we get there, staring at $1.5 billion budget shortfall in our face and really are scared to death of what the future is going to be, we're going to have to work together, and we really need people in office that not just say they will, but that truly will sit down and work together. Thank you.
Thank you. Anne.
Thank you. Well, I'm looking at this in several different ways, because I'm in a community that a good 20% of its business is from Canada. We have a closed border. And if there's any way that we can work with our sister county, province, to find a way to open that border up, that will help some of our small businesses. But it's more, Washington County is really a small and micro business county. But there are other things. We have a nonprofit hospital that is on the verge of closing. That is going to affect our economy almost as bad as the pandemic for two reasons. The hospital is not only the people it employs, which is about 250 people, but we have a mill in the next town. And how are we going to recruit? How is this mill going to recruit young engineers with families when the access to healthcare is very limited? our education and our healthcare system really needs to be looked at as well. And we can't look at one thing without seeing the whole picture. And so we do need to find ways to help our small businesses, but we can't exclude the effect that some of our nonprofit organizations and businesses are affecting our economy as well, and finding ways to bring that forward as well. Thank you.
Thank you. And then the last word goes to Michael Lawson. Thanks.
Excellent question and excellent answers from everybody. You know, Ann said it best. If this hospital here closes, our nearest healthcare is Eastport. The VA, I'm treated under the VA, and I get treated at Calais Regional a lot. And if that closes, my next stop is Machias. If that one closes, my next stop is Bangor. You know, so we jump an hour every time hospital out here closes. So we really need to look at helping every aspect of our economy, not just the small businesses. The small businesses employ about 70% of all the employees in the country. So they're important, yes. But these other businesses that are there as well, they have a place in our society, and they have a place in our economic development. And if we don't have a little piece of everything here in our county in down East Maine, we will lose out on a lot of people coming in. One of my biggest questions to the young kids when I get a chance to talk to them is, when you graduate high school or you graduate college, what will it take to keep you here? And the one thing they always say is, I need a job. And I'm like, well, why do you need a job when you can go to work for yourself? Like we've heard many people talk about. And that's one of my big things right now. I'm in college for business development, due to graduate in December. And we are creating jobs. We are trying to get jobs in and creating businesses so that these people can build businesses and hire more people. So I think, you know, looking at all the aspects, the legislature could help the small businesses as well as the medium-sized businesses that employ the 250 to, 500 or 1,000 people, and put that evenly across the board while helping these small businesses. I got to throw a shout out to Susan Collins. Senator Collins approved that PPP, and without that, our business wouldn't have done we wouldn't be here right now if it wasn't for that plan. 65% of our business comes from Canada. As Ann said, we are a border town, and we rely, I'm not going to call them my sister because I'll get beat up when the border opens. So I'm going to call them our cousin county over there. It kind of leaves it gender neutral. So, we need to work on getting this border open, and we need to work on trying to figure out how to assimilate all of the businesses here in down East Maine to help our economic development.
Thank you very much. And then I think pass it on to John for closing statements.
Thanks, Tora. So we're going to go in reverse order of what we did the initial statements. So be Don Greene, Kathy Javner, Michael Lawson, Ann Perry, Will Toole, Robert Alley, Kim Robinson, Robert Alley, and then Jeff Lovett, finally Marianne Moore. 90 seconds. I'll shake my head when you've got about 10 seconds left. And we'll start with Don Greene.
Thank you, John. I'm really happy to participate in this discussion that we've had tonight, and I hope that there are more people who have listened to this. From what you've heard from me, I'm someone who believes in the individual and individual effort and working together with others to make things better. That's why I'm running, to see that I can get that kind of participation in Augusta for Washington County, in particular for Washington County.
Don't know.
Talked about the things that are necessary and needed here, and I think that some of it can come from there, but we have a lot of really good ideas here. Not only that, we know what needs to be applied and what needs to be done. So as a society, we're transitioning from where we have been in the past, where the factory dictated how we worked, how many hours, what days of the week, and so forth, to an economy now which is based on the technologies that we have, our ability to work from home, to actually work from our own minds into the world, and to have ourselves be present to so many more. So again, I am asking for people to participate in voting and to vote for me, and send me
Thanks, Don.
so that I can do more. Thank you, John.
Thank you, Don. Kathy,
Great, thank you. Again, thank you both very much for moderating tonight's sessions. I appreciate this opportunity greatly. The last few years serving in the legislature have been two of the most challenging years of my life. I will say that beyond parenting and being a wife, I have enjoyed it absolutely tremendously. It has been an honor and a privilege to be in Augusta representing the residents of District 141. If any of you have listened to our committee meetings, you will hear me very often read every single town of our district off. I know that it takes a lot of time and I don't do it every time because we're on the clock. However, every single town and unorganized territory that is in District 141 is extremely important to me. And it is just an honor to be able to listen to, and I've met so many amazing people as I traveled through District 141 and gone to different towns. And as I've seen or heard from many, many, many people, it has been my privilege to be able to find those solutions to the questions. You never know what that phone call is going to bring, to a dog attack, to the roads, to, you just never know what that's going to be. And so it has been amazing opportunity. I look forward to continuing that representation in the 130th legislature. Thank you.
thank you, Kathy. Boy, that was to the second, 90 seconds. Michael.
I just want to thank you for putting this together for everybody. I'd like to say that we, the people, oversee our own destinies, and that a small limited government could help in that goal. We, the people, are what keep this country that we have afloat, running, and prosperous. You, I, and for that matter, we have the right to have the pursuit of happiness that we all want without the interference of the government, as long as we aren't hurting other people in our endeavor for that happiness. I wholeheartedly believe in a more limited government, but I wholeheartedly believe that the government is there to help at the same time. So there's a balance that we have to find and we have to come to for that. My leadership was developed over 7 years in the Marine Corps. I was later a Air Patrol for 8 years. I was a mountain mission pilot, cadet orientation pilot. We flew search and rescue, and I was on the ground team. I was a ground team member with that. I served 7 years with the fire departments. I would love to take all this leadership experience in my business that we own, in the business that we manage, and I would love to take that to Augusta and work for everyone in District 140, from the Passamaquoddy all the way down to the Wabanaki to the average person. We are all one people, and we need to look at it that way. Thank you.
Thank you, Mike. Anne.
Thank you. This has been an unusual session, an awful lot of work that we've left unfinished. And I think one of the things that we were working with that I have the greatest concern about is our work on the Maine Indian claim settlement. This really got stunted in the middle of the work. And Senator Moore and myself worked very hard on negotiating some of the solutions that have gone forward that now are left undone. I want to be able to continue that work and advocate for the tribes as well as work on helping with the hospital to continue the work that I've started there, and to be able to still represent all of the people, regardless of affiliation in this district. And I hope that they have confidence enough that I can do that. And thank you.
Thank you, Ann. Also very, very prompt. Will, and then Kim and Robert Alley.
Well, I want to begin, and I want to close tonight by thanking you all for hosting this. As a UMM graduate, as a former newspaper writer for the Down East Coastal Press, who covered this event for years before I ran, it's always easier to write it than it is to participate. But it's always been appreciated that UMM does this. UMM is a center of our community and is a vital resource to it. I think going forward, we need to make sure that that stays the case. And I want to thank President Farini Mundy and President Qualls at UMM, or head of campus Qualls, for their part in shoring up UMM. I think beyond that, we as a legislature, and I've been talking about this all night, really, we need experienced people with experienced leadership skills. I've been selectman in East Machias for 11 years now, worked up with the delegation for the past 6, and whether it's Marianne or Joyce Maker or Ann or Robert or whomever it happens to be, we always try, even when we don't agree, we always come to an understanding. We're always there for one another. I want to thank Robert and Ann in particular for their help on our Washington County District Attorney bill, which got bit by COVID, and which I'm pleased to say, if I'm back, will be coming back. That issue is too important to abandon. And I think we need to continue working to, that's yet another way of how we as a county can work together to improve the quality of life here in Washington County, whether it be for businesses, fishermen, schools, towns, whatever the case may be. And I don't look at parties, I don't look at labels. Whatever you are, that's what you want to be. So I know my time's probably up, but thank you all. Thank you for voting.
Thank you, Will. Kim.
Yes, thank you. And like everybody else, thank you for Jon and Tora for hosting this event and having me back again. And I want to close by saying that after school here, graduating, I was one of the ones that moved away. There was nothing here, you know, or at least there wasn't nothing that was holding me back here other than my family. But I needed an education, I needed a life, so I moved away. I got my nurse's degree to be there for my father when he got older and needed some help. And when that time came, that's why I moved back, to be here with my father before he passed away. And now that I'm here and, you know, I'm reacquainted with my old friends and family and just the love of this area. You know, there's nothing like the rocky coast of Maine. You know, down in North Carolina and North Carolina and Southern Carolinas, the beaches just were not the same. And what we determined is there was just not enough rotten seaweed and lobster bait there, you know. So I'm back and I want to do everything I can to protect our way of life. And that is the coastal the fishermen, the clam diggers, and all of the self-employed people here at the small businesses, the blueberry people. I want to help them all. I don't want to stop with just one or two sections. I want to get my hands into everything and just do everything that I can to help protect our way of life and the way as we know it. Because living away in New Hampshire and seeing just the policies and the way life is, the more that we let things go. He's shaking his head.
Oh, yeah. Yes. Thank you, Kim. Robert. Oh, you're still muted, Robert. You need to unmute yourself, Robert. Robert, you need to unmute yourself. Oh.
There, I got it. I've got it now.
Okay.
Yes, sir. I thank you guys for having me on here. Even though I'm late, I went to Sarah Gideon's meeting down in Perry. But we did discuss some things about the economy, and I think that we need to apply our knowledge to help the economy in down East Maine, and working with others to achieve our goals will take a lot of work, hard work. But I think that all of us is ready and willing to get on the bandwagon and go back to Augusta and see what we can do. And the Down East delegation will do its share of work, I'm sure, like we always do. And I can picture Will Toole right now, head of the game. He always is. And we'll be right there for Down East Maine until we're done. Thank you.
Thank you, Robert. And now, excuse me, Jeff Lovett.
Well, I want to thank the university and the moderators, and especially all of you online for this opportunity to talk with you tonight. This is the most important election in my lifetime. Who we elect as president and as senator will set the course of our nation for a generation. With such important races at the top, it would be easy to overlook the main legislative contests, but that would be a mistake. Our state faces a huge challenge. How do you meet the needs of Maine citizens while dealing with an estimated $1.48 billion deficit over the next 3 years? Budgets are about numbers, but behind those numbers are people. Budgets are also about values. As your senator, I will fight to protect our communities, our hospitals, our schools, and our elderly. My vote belongs to you and not to my party or to any party leader. I believe I have the experience as a lawyer and a small business owner for 41 years, and as a business mentor for SCORE for the past 5 years, to best represent you in the next legislative session. However, if you elect Marianne instead, I will support her in every way I can. In Washington County, we are a community. We have to work together to see that our voices are heard in Augusta. Thank you.
Thank you, Jeff. Marianne.
Thank you, Jeff. I appreciate that support as well. Again, thank you to the organizers for the opportunity to come out tonight and to answer your questions and your concerns, and for all of those that are out in the listening group there. With the support of the voters, I will continue to fight for common sense priorities. Making fiscally responsible decisions on budgets affecting rural schools in our towns and cities are going to be very, very important. Strengthening infrastructure and our roads, supporting the broadband expansion, making it easier for small businesses to thrive and create jobs, protecting our elderly and advocating for veterans, ensuring rural areas such as ours continues to have access to affordable quality health care, supporting our law enforcement and solutions to the rising drug epidemic. And as Ann Perry mentioned, and to finish the work that we started on the Indian Claims Settlement Act. So as a community leader, I would be honored to continue working for the citizens of Washington County in Augusta. And I encourage everyone to get out and vote early or on November the 3rd. Thank you.
Thank you, candidates, very much. Thank you, Tora, John Stentz. And as we have this strange year, I will just conclude by saying Zumbaya.
I like that.
Thank you, John, for organizing.
Thank you all.
Thank you all.
Yeah.
Good night.
Thank you.
Good night.
Good night.
Bye.
Good evening.